free.
I now recognize myself for 5 minutes for an opening statement. Good morning and welcome to this Joint Oversight and Investigations and Health Subcommittee hearing examining the federal response to COVID-19. Before we start, I would like to extend my condolences to Assistant Secretary O'Connell of the Administration for Strategic Preparedness and Response, who was planning to testify here today, but unfortunately her sister passed away. To date, more than 1 million Americans have died from COVID-19, and on top of the loss of life, the pandemic brought our country to a standstill. It cost our economy around $15 trillion. That equates to more than 200,000 small businesses permanently closed due to the pandemic. Schools were closed for far too long, setting children behind in learning and damaging their social, emotional, and in many cases, their physical well-being. The nation is still recovering from the pandemic's impact and the damage it caused. Given these losses, it is appalling that the last time we had the heads of the public health agencies before us was March of 2021, almost 2 years ago. We held a hearing last week with the Governmental Accountability Office and other experts in the field of pandemic and biological outbreaks, where we discussed how being able to quickly identify the root cause of a disease outbreak or biological incident is crucial for a list of reasons ranging from countermeasure development to identifying what activities may have been responsible for the pathogen outbreak. While the worst of the COVID-19 pandemic is likely behind us, there are a host of areas that we need to examine, including actions taken and not taken by the federal government, as well as how we address future pandemic preparedness. By all accounts, the risk of catastrophic biological incidents and infectious disease pandemics is increasing, so it is critical that we understand in detail the federal response. Since the heads of these agencies have not appeared before us in quite some time, we have a lot of questions about federal government's response to COVID-19. Further, many of the questions we have are due to a lack of response to congressional inquiries regarding COVID-19. One of the major concerns that has gone unanswered by the National Institute of Health is the lack of compliance and oversight into grant awards to EcoHealth Alliance. There are a myriad of compliance issues surrounding EcoHealth and their sub-award grants to the Wuhan Institute of Virology, specifically for coronavirus research. The NIH has been reluctant to answer our inquiries on issues such as EcoHealth withholding data, potentially double billing the federal government, and missing laboratory notebooks and electronic files that were supposed to be delivered to the NIH by EcoHealth. This process does not have to be confrontational. Republican leaders have sent a similar letter to entities such as Boston University about an experiment involving a hybrid COVID virus that attracted press attention. Boston University fully cooperated, sending a written response letter directly addressing the questions, producing about 2,000 pages of documents, and providing a briefing to bipartisan staff. In contrast, the NIH has not provided a satisfactory or complete response. This is not acceptable. Let me be clear. It is not acceptable to stonewall any member of Congress with oversight authority, whether that member be a Democrat or be a Republican, whether that member be in the minority or in the majority. The people of America entrust us to find the answers and to provide oversight of the federal government. Another one of the many issues that we hope to address today is the Centers for Disease Control and Prevention and their rationale for masking and the closure of reopening schools. We now have the findings of a comprehensive review of multiple randomized controlled trials that show, quote, no clear reduction in respiratory viral infection with the use of medical surgical masks, end quote, or in fact, with the use of N95 masks. The conclusion of these studies makes me wonder what evidence there was to justify forcing masking of our children. The members of these subcommittees also have questions about pathogen research being funded and conducted by federal agencies. In the United States, we've recently seen high-risk research done to intentionally modify pathogens, such as NIH experiments to enhance monkeypox virulence. As a final note, I hope that our witnesses are more forthcoming and cooperative as we move forward. At the end of the day, we need to work together. The committee's majority is willing to work with you and our Democrat colleagues constructively to deliver solutions and pave a path forward for America. We want to work in common purpose for the national good, but we must be partners. You and your agencies must be transparent, responsive, and cooperative in order for us to be able to work together. I thank the witnesses for being here today and for being a part of this important discussion. All right. The chair recognizes the Oversight and Investigations Subcommittee Ranking Member, Ms. Castor, for 5 minutes for her opening statement.
Well, thank you, Mr. Chairman, and thank you all for being here today. Thank you to our witnesses. Thank you for all that you do to help keep Americans healthy, safe, and well. I'm sorry that Assistant Secretary for Preparedness and Response, Dawn O'Connell, cannot be with us today to share her expertise, and want to express my sympathies for the sudden death in her family and her loss. I appreciate, though, that she did submit testimony and has agreed to respond to written questions. Well, all Americans are relieved that we are emerging from the worst pandemic in our lifetimes. Over 1 million American lives lost. Examining the response to COVID-19 will help us prepare for the next public health emergency. But if we take ourselves back to those early days of the pandemic, I remember very well the public was scared, they were uncertain, but public health experts in government and across the country mobilized to better understand the virus, to develop vaccines and treatments, and try to provide us with the answers in the face of great uncertainty. They worked to follow the science and improve guidance as we learned new information about the virus and how to contain it. And they were trying their hardest to save lives in the face of a new threat. The tone from the top, however, was very different. In the earliest, most critical days of the COVID-19 pandemic, then President Trump downplayed the threat, saying it was one person coming in from China, and we have it under control, and it's going to go away. He improvised from the White House briefing room about potential treatments completely unsupported by science and sometimes dangerous. Hydroxychloroquine, bleach, ultraviolet light. He repeatedly undercut the hard work of public health officials who were up against one of the greatest threats to our country in modern times. Despite this, the Republican majority now somehow claims that the Biden administration is to blame for reduced confidence in public health institutions. Over the past 2 years, Republicans have repeatedly chosen to cast blame on the Biden administration and career public servants to deflect from their leaders' early failures to contain the pandemic. And some have actively spread misinformation and tried to hide vital public health data. At last week's hearing, I stated that I was hopeful that we could avoid in this committee the kind of partisan attacks on public servants that we have seen taking root in other committees across the House, and instead focus constructively on how to strengthen our public health infrastructure for the future. Unfortunately, just one day after last week's hearing, this committee sent a letter to NIH requesting a huge number of documents and transcribed interviews of career staffers, while implying that the agency is hiding information about the origins of COVID-19. Democrats, however, remain focused on how to restore and maintain trust in the world's top health institutions represented here today. Give them the tools and the resources they need to keep Americans safe and ensure that the public has the best information based on solid science to make decisions. Combating the virus is an enormous challenge. It continues to mutate, and our response and strategies must evolve with it. But what will remain constant is my firm support for strong public health institutions which have saved countless lives. I'm immensely grateful for the witnesses' leadership. I look forward to hearing how you plan on incorporating the lessons learned from COVID-19 to further strengthen your agencies and these important missions for the future. I yield back my time.
Thank the gentlelady. Now recognize the chairman of the Health Subcommittee and the co-chairman of today's joint committee, Mr. Guthrie, for 5 minutes for his opening statement.
Thank you. I welcome all of you guys here today. Good to have you here before us, and my condolences as well to Assistant Secretary O'Connell and her family. A little over a week ago, President Biden says his administration would end the COVID-19 public health emergency on May the 11th, and I'm glad the president formally announced he would end the PHE and relinquish the emergency powers. However, after over 2 years into the Biden presidency, Congress and the American people have little to no visibility into nor input on the administration's pandemic response, and we're going to change that today. Today is the first of many opportunities for both members of this subcommittee and by extension our constituents to ask important questions about decisions made by our nation's leading public health officials in response to the COVID-19 pandemic. My hope is that this work leads to reforms that make us better prepared for pandemics and other public health security threats in the future. To start, public trust in our public health institutions is at a low, and this is driven by federal government's misguided and inconsistent preparation for and response to the COVID-19 pandemic. This is heightened by confusing, sometimes conflicting communication and guidance coming from our public health agencies. In the earliest days of the pandemic, the CDC stumbled rolling out testing kits. The Food Drug Administration took too long to authorize diagnostics, and the Strategic National Stockpile was ill-equipped with deficient and expired equipment. Thankfully, Operation Warp Speed was able to cut through some of this red tape and bureaucracy to facilitate the rapid development of vaccines and therapies that help prevent serious illness and death from COVID-19 and put us on the road towards normalcy. The pandemic has also exposed how our public health agencies failed at their core functions to be good stewards of taxpayer dollars. The National Institutes of Health flattened HHS-wide rules on conducting proper oversight of potential pandemic pathogen research. After living through COVID-19, the origins of which still largely remain unknown, it is absolutely clear that we must require strict federal oversight of these risky research projects. And of COVID-19 origin, NIH's refusal to acknowledge any suggestion that the COVID-19 virus may have traveled from nature to a lab to humans continues to fuel the controversy and questions around it. To discover the truth and instill confidence back in our federal research programs, why not engage in a robust, honest, and transparent dialogue and investigation? Instead, federal officials work with social media companies to censor those who offered a differing viewpoint, further fueling public distrust in our public health institutions. Unfortunately, the Biden administration's one-size-fits-all approach to the pandemic has only made our response even more challenging between inconsistent CDC COVID-19 guidance policies, testing challenges, the FDA rationing of key therapeutics, to name a few. Among these mistakes carried significant real-world consequences. Kids and parents were left with limited options for in-person instruction because the nation's largest teachers union offered line-by-line edits on reopening guidance. This robbed our kids of the benefits of in-person instruction and has had devastating effects on kids struggling with anxiety and depression at unprecedented levels. As members of this committee, we also cannot permit mission creep into our public health agencies. We must ensure our federal partners are focused on their core mission of preventing, preparing for, and responding to public health emergencies. Luckily, we have a chance to address many of these systemic issues that hindered our federal response to the COVID-19 pandemic. I look forward to working with my colleagues on this subcommittee, and I look forward to working with our witnesses here today to consider appropriate reforms as we work to reauthorize the Pandemics and All Hazard Preparedness Act, or PAPA, that will be led by our colleague, Mr. Hudson. Doing so can make a difference between life and death of millions of Americans. I thank you, and I yield back.
Thank you, gentlemen, for yielding back. Now recognize the ranking member of the Health Subcommittee, Ms. Eshoo, for her 5-minute opening statement.
Thank you, Mr. Chairman, and good morning to the witnesses. Thank you for being here today. On March 11th, 2020, the World Health Organization declared the coronavirus a pandemic. Now, 3 years later, we have the benefit of hindsight, and we know we were unprepared. We lost 1 million precious souls in our country, grandparents, mothers, fathers, siblings, and some of our colleagues. Now, we have to do everything possible to prepare our nation for new and emerging threats to public health. We have to learn from the mistakes made, including the faulty coronavirus testing kits that the CDC insisted on developing on their own, which allowed infections to spread undetected. The bare cupboards of the Strategic National Stockpile, leading to our nation's heroic healthcare workers wearing trash bags as protection. A long legacy of racial health disparities and a weak social safety net that allowed the virus to disproportionately infect and kill Black, Hispanic, and indigenous people. A chronically underfunded public health system whose poor data undercut the government's response to COVID, and confusing and opaque public health communications which bad actors took advantage of to spread misinformation and discourage life-saving vaccinations. It's also clear where the federal government succeeded in its response. Because of the work NIH was already doing when the pandemic began, researchers were able to develop a safe, highly effective vaccine for the new virus very quickly. COVID vaccines have resulted in 120 million fewer infections, 18.5 million fewer hospitalizations, and 3.2 million lives saved. Nimble decision-making by the federal government and Congress allowed more Americans to get health coverage, Medicare to cover telehealth and at-home care, and the FDA to use emergency authorizations and flexible clinical trial designs to provide treatments and vaccines quickly. 3 years later, our nation is finally recovering from the pandemic. Now we have to incorporate the lessons we've learned to strengthen our public health infrastructure before a new threat is upon us. Our nation's health and security depend on this. I look forward to the testimony from the three heads of the agencies that are here today, and that their testimony be highly instructive to us on how we can improve our federal response going forward. And with that, Mr. Chairman, I yield back the balance of my time.
Thank you. And now recognize the chair of the full committee, Ms. McMorris Rogers, for her 5-minute opening statement.
Thank you, Chair Griffith. The questions that we're asking here today are the questions that we hear from people in our communities every day. As the people's elected representatives, we have a responsibility to conduct oversight. President Biden's public health leaders are here today because they have broken the American people's trust. I'll start with you, Dr. Tabak. I was once a huge supporter of NIH. The overall lack of responsiveness, the suppression of dissenting voices in the COVID origins investigation, the frequent mixed messaging on health precautions, the NIH is falling short of its goal of integrity and accountability. For the past 2 years, we've pressed for answers about what kind of research you're funding with taxpayer dollars and what sort of oversight you're doing to ensure funds are not misspent. Your cooperation has been abysmal. Next, Director Walensky and the Centers for Disease Control and Prevention. Your guidance was used by the federal government to justify mandates that have more parents questioning routine vaccination. Your guidance, influenced by teachers' unions, kept schools closed. Your guidance, using unreliable studies, was used to justify mask mandates on our kids. We know these weren't decisions based upon best science and data from around the world. And now our children are paying the price. Academically, they've been set back for years. Emotionally, we are living through the most severe youth mental health crisis we've seen. And physically, cases of type 2 diabetes and obesity in children has surged. Dr. Walensky, the CDC does not need more authority. It needs robust oversight. It's always operated without a congressional authorization, and it's going to change. Dr. Califf, the FDA has failed to alleviate the concerns about the vaccine. I'll note that before imposing authoritarian vaccine mandates, as president, candidate Biden made statements about the vaccine that did lasting damage. But top vaccine review officials, Marion Gruber and Phil Krause, left FDA as the Biden administration was working to authorize boosters, doses which many people may not have needed. And beyond the vaccine, FDA inspections of foreign sites are woefully lacking. Innovators can't get the guidance they need to approve standards, and patients are the ones left without the innovation or supply of products they need. Finally, regarding Assistant Secretary Dawn O'Connell's absence, I understand why she's not here today, and I extend my deepest sympathies, condolences to her and her family. However, the Administration for Strategic Preparedness and Response is the top official in public health emergencies. ASPR's job is to be prepared, so it's unacceptable that another leader from the administration wasn't prepared to be here today in the Assistant Secretary's place. There are no excuses, especially given the enormous amounts of resources and responsibilities we've allocated to ASPR over the years. My message today to all the administration public health officials is that this is going to be a long road. Trust is broken a lot faster than it is built. And many will say that the American people deserve an apology, but they deserve much more. I think about every person who lost a loved one to COVID-19, the people who died alone because of COVID-19 policies, the frontline workers who sacrificed but were still forced out of their jobs because of vaccine mandates, and the children isolated and set back from school closures. Surely, we can all agree that for them, we cannot repeat the mistakes of the pandemic response. They deserve full accountability and transparency, nothing less. That is the bare minimum of what we expect today, so that we can begin to heal, restore trust, and better prepare for the future. Thank you.